Welcome back to breakfast, Sunday breakfast right here on Channel One TV with myself, Jude Duncan, and Enos Safo. Just gone by our guest artist for the day, Daniel Foley, taking us through a moment or a spirit-filled moment. But for now, we shift focus. We move straight into our health discussion. Our very favorite on the show, one of us on the show, Dr. Kalsum Adams has joined us in studio. We'll be delving into the big health conversation we have for you today. But just before we do that, some of the messages have been coming in, and we'll just go through some of them very briefly before we delve into our health conversation.
Yes. So I have here from Kweku Dankwa in Kade. I completed uni in 2014, but had a job in 2019. I pledged to vote for NPP and Baumia. Another one says, why should I even waste my precious time to go and vote? I'll just stay at home and eat some banku and okra soup and sleep. His name is Headmaster Phones. I'm voting for JM. The economy is very hard. Ghanaians need change. Nyaba Felix from Kentampo. Good morning, my lovely friends. I'm Yak. I'm voting for JDM to rescue this nation from bad governance, lying to God for building him a cathedral, and to hold this current government accountable for grabbing state assets nyafu nyafu. Good morning, Eno and Jude. It seems we are forgetting the biggest third force in the Ghanaian politics, spoilt, rejected ballot party. We members of this party don't campaign, but we will beat a lot of political parties in this election.
You don't spoil your ballot.
Don't spoil your ballots. Don't spoil your ballot.
That's irresponsible citizenship.
Simon and Ashaiman, don't spoil your ballots. We beg you.
Don't
spoil your ballots. Another one here. Hi, good morning, guys. I'm Mohammed Yakubu. I'm here near Ablikuma. I'm voting for Mahama and the NDC because of the 1, the review of SHS, 2, 24-hour economy, 3, accountability of the current government, decentralizing the agric sector.
Doc, do you believe in a third force? I know you are. I don't want to limit you to the stethoscope, but just briefly. Are we ready for a third force?
I don't think so.
I don't think so.
Yeah, I don't think so, yeah.
So it's one of the two?
Yeah.
Wow.
That's what I think, but I mean, everybody has his or her own opinion. Yeah.
And what are the health considerations? You know, they said now there's free dialysis, and there's also mama care.
Hypertension.
You know,
Oh my goodness.
Hypertension, definitely.
We only hope the best team wins.
The best ideas.
Yes, and then they would be able to take our health sector to the next level. So that's what I'm wishing for.
Kolobu is part of the free dialysis this month.
Yeah.
One of the centers.
Yeah.
Are you guys ready?
I'm sure we are. We should be ready. Because of, I mean, Kolebu dialysis unit is already well equipped, so we should be
one of the
able
best
to.
we have in the country, if not the best.
Yeah.
Wow. We'll see how it goes. We'll be there to follow the free dialysis promised by the NHIS. We'll see how it goes. Doc, today we are looking at bleeding gums.
Yeah.
Wow. Why bleeding gums of all the health concerns out there?
All right. So bleeding gums, because it's one of the commonest symptoms that people or patients would present with. And it's very common. People may end up having bleeding gums, but what do they do after getting a bleeding gum? Do they stop brushing? Do they have to rush to the nearest hospital to seek advice? What's the way forward as soon as you have some bleeding gum? That is, some may be sudden, and then just once, but others too may persist for some long periods. So what do we do about it? Because it's one of the commonest things. And should we be worried? Should we be more concerned when we see it, or should we take it lightly? So that's why we want to talk about gum bleeding and what are the causes, the possible causes of gum bleeding, should you have any. And I know that everybody brushes their teeth morning and then evening. Well, some people do, at least the morning, most people do it, but for the evening I can't be sure if everybody does it. But morning, so it's a daily thing that you do most of the time. But people may end up having some blood, and you know, anytime there's blood or there's color within when you are brushing, people get a little scared about it. So there are a number of reasons why people may end up having some blood stain when they are brushing their teeth, or they end up, sometimes it's not even only when you are brushing. There are times that you may just be there, maybe you have been inactive for some time, and then the next minute you notice that you are tasting blood
Yeah.
in your mouth. So what are the considerations, or what are some of the causes of gum bleeding? So the first on the list we would want to talk about is basically inflammation of the gums, and then of the supporting structures, which we call periodontitis. So that's the first one and the commonest of all. And the other causes may be that you may end up having, it's likely that when you have gum bleeding, it's likely that you have some systemic condition happening. So systemic condition, one of them could be diabetes that we spoke about at length last month. Okay, it could also be that you may end up having, it may be an indication of what we call hematological conditions. So hematological conditions could be that is it some cancer of some sort, or is it likely that you have something we call thrombocytopenia, where you have your platelet levels are lower than usual, okay? Or could it be that it's a clotting factor deficiency? So clotting factors are proteins within the blood that help you coagulate or help you to stop bleeding anytime you start bleeding. Okay, so could it be that as well? So it could either be hematological, which I have mentioned, or systemic, which we have also mentioned, or it could be that you may have some systemic deficiencies in your vitamins. So typical of them is vitamin C. So vitamin C, we know that it's widely spread in our fruits and our diet. Like almost when you're taking some oranges or you're taking some pineapples, you should have some vitamin C in there. So they are typical, those who have vitamin C deficiency, people with scurvy may end up having gum bleeding as well. And then we can also mention vitamin K deficiency. So vitamin K also helps with bleeding, with you securing some hemostasis or you clotting. So if you don't have vitamin K, it's likely you may end up with some gum bleeding as well. And then the other thing, or the most commonest, which we have mentioned, is the gingivitis or the periodontitis, which is caused by something we call accumulation of dental plaque, or plaque within or around the gums or the necks of the teeth that hasn't been cleaned over a long period of time, and then eventually it ends up causing inflammation, and then you may end up having gum bleeding. So then what do we do if you notice that? Maybe I should mention also trauma, very important. It could be that people are scrubbing their teeth instead of brushing their teeth. Exactly. So trauma, it's an important thing that I have to mention before we move on to what you do. So people may be scrubbing their teeth instead of brushing, could also be an indication. It will just end up causing trauma to the gums and then the supporting structures, and then you may end up having not only bleeding but also pain within the oral tissues. Okay, so now what do we do when you have gum bleeding? So we would want to focus more on the main causes of gum bleeding. So even though we have mentioned all the others that I did earlier, we'd want to focus on the main factor that is most likely. So you need to investigate that first, and then if you notice that is stable, the gum health is stable, the periodontal health is stable, and the patient is still bleeding, then you would need to go systemically and then check for other causes that we have mentioned. So we'll focus on gingivitis, periodontitis. And how does this come about? Basically, it comes about from plaque. Every morning you wake up, you brush your teeth. What are you brushing? I don't know if you've asked yourself that question before. What are you brushing off? Are you brushing off the debris? Are you brushing off to get a fresher breath? Or what are you doing? You
I
get it?
assumed it was the fresher breath.
Okay, so most people will say fresher breath. And others too may say that, okay, we are brushing because we feel that maybe there's something around our teeth that needs to be taken away. And that's true. Because the moment you brush and you brush effectively, what happens is that if you have brushed very effectively and removed all the plaque that has accumulated over 24 hours, at least for the first hour or two, what happens is that you have this pellicle forming around the teeth. So it's a clear pellicle. It's from the saliva that you have in your mouth. So it just forms, it's like a thin, transparent lining around your teeth. It's a clear pellicle. Then after that hour, so from 3 hours to about 4 hours, then you start having bacteria colonizing on this pellicle. Okay, so that bacteria, most of the time you have the Streptococcus sanguis and then Streptococcus mutans coming in to attach themselves to this clear pellicle. And then after 4 hours to about 12 hours, you have these bacteria that have colonized start producing something we call extracellular polysaccharide matrix. Okay, so it's their own metabolites. It's their own metabolites
Big
that
words.
they produce. Yes, big words, I know. So it's their own metabolites that they do produce. So when they produce, it tends to make that clear pellicle now receptive to other things that come into contact with the mouth. So it becomes more sticky, and then any other thing that comes into the mouth, now it can stick on that pellicle and then lead to maturation of this pellicle and then plaque eventually. So if you want to see this plaque after a hard day's work or even early in the morning, when you look inside the mirror, you see that there's this cheese-like or whitish film around all your teeth. So that is what we call plaque. Okay, but unfortunately, if this plaque is not removed after 12 hours or after 24 hours, what happens is that because you have saliva in your mouth and the saliva contains calcium, this calcium will then precipitate out of the saliva and then harden, cause this plaque to harden up. So then eventually you end up having this plaque that hasn't been removed over 12 hours, over 24 hours, being hardened. So you have it at the necks of your teeth. So sometimes when people smile, you see this yellowish kind of hard thing around the necks of their teeth, okay, which is called calculus. You get it? Now, if this calculus stays there for a long period, what it does is that it causes or it harbors more bacteria. And then this bacteria will tend to cause inflammation of the gums, inflammation of the bone that is holding the teeth. And then now you end up having bleeding anytime you brush your teeth. So now the simple analogy is that, so if I brush my teeth and then I see blood in it, should I increase the intensity of my brushing or should I reduce it? What do we think? You get it? Because people say that, okay, as soon as I start brushing, I see blood. Okay, if it's not trauma, given that it's not trauma from maybe a hard brush that I'm using, should I continue brushing or should I actually stop brushing?
Right.
And the answer is you have to continue brushing because whatever that is causing the bleeding is the dirt around your teeth. So if you think that you want to stop to prevent the bleeding from happening, you are rather making things worse. You get it? So it means that more plaque is going to accumulate and then more bacteria is going to act. It's going to have more time to act on the gums and then eventually you are going to end up bleeding and bleeding more and more. So if you do have bleeding and it is coming from plaque that has accumulated over a long period, you need to continually brush. And it's only when you continually brush and effectively remove this plaque, that's the bleeding will stop, because it will remove the causative agents from there, and the whole inflammatory process will come to a halt and you will not bleed.
What if the is harmless?
Yes, that's a very good question.
The toothbrush cannot, you know,
yes, a very good. For that, there's something that is done in the clinics. It's called polishing.
Right.
Cleaning and polishing is going to use this ultrasonic machine, which would vibrate and then break away all of these hardened calculus. Okay, so it's very important. Once it's hardened, it becomes difficult to actually remove it with your regular brushing. So you need to visit a healthcare provider for professional cleaning to be done for you. And then that needs to be done every 6 months. Every 6 months. No matter how effective you brush, research has shown that you may not be able to brush out all the plaque. There may be some of this plaque that would be left behind below the gums. So when the gums, we usually call them gingiva. Okay, so supragingival means above the gingiva. Subgingival means below the gingiva. So supragingival, you can see that when you open your mouth, you can see anything above the gum line, you can see it. But anything below the gum lines, you won't be able to see. And the plaque and the pellicle doesn't only form supragingivally or above the gum lines, it also forms below the gum lines. So you need to have this cleaning done for you at least every 6 months if you have healthy gums. But then, if you do have something we call periodontitis, that means that the plaque has ended up affecting or causing more inflammation and destruction of the supporting structures of the teeth or the jaws. That's the bone and then the cementum and all of that. Then you need to be giving a tailored timelines for cleaning. So it can even be 6 months, it can be 3 months, it can even be shorter than that, depending on the situation that is seen. So far we've spoken about, gum bleeding and what exactly causes gum bleeding. The most important cause of the gum bleeding being that if you have gingivitis or periodontitis, that's the most important causes. But other causes, I made mention of so many others, but what I want to focus on will be trauma. So trauma being that people are not brushing well, or people are brushing with different techniques that are not appropriate for you to keep healthy gums, or people are using certain toothbrushes that they are not supposed to be used in their mouth. So this will end up causing destruction and traumatize the gums, and then eventually end up giving you some bleeding. So the first I would want to talk about is the type of bristle brush that you should use. So I know that sometimes you ask people randomly, what bristle brush do you use? They don't even know. People don't even know that. Exactly. They don't even know that if you are going to purchase your brush, there are labels at the top of it. So you can either see medium, or you can see hard, or you can see soft. So ideally, you should look out for these before you purchase any of the brushes. So for adults, it's recommended that you use medium toothbrushes. And then for the children, you can use your soft toothbrushes. Okay, and there are times that maybe a soft toothbrush may be recommended for a short period for an adult as well, depending on what is seen. Now, the hard brush is not for brushing. I'll say it again, the hard brush is not for brushing.
So then why are they even in the
People
system?
even go using smokers.
I've seen that one.
People actually use smokers, and it's so hard.
And then they
So then why is it then on the market?
Exactly. So it's something that I'm sure FDA would have to work on, you know, because people end up having this extrinsic stains on their teeth. So sometimes you can see that their teeth are brown because of chronic smoking or use of or drinking of excess drinking of coffee. Okay, So people think that when they use the smokers or the hard brush, they are able to remove all of these stains. But they forget that if you are trying to remove these stains from your teeth, the teeth surfaces, yes, it affects the supporting structures, which are your gums or the fleshy part of your teeth. Okay, and that is the most important part of your oral cavity, and you may end up traumatizing it and causing problems.
No, but just to be
some
clear,
questions here for
tobacco use could or tobacco use can predispose you to gum bleeding.
Yes,
right?
yes, it can.
So then, then using a smoker's toothbrush should then be the remedy to.
No. So the remedy to that would be for you to quit smoking. That's one. The other thing would be that whatever distraction that has been caused after you quit the smoking would then be assessed and then treated appropriately.
Maybe we can go through messages from
yeah.
Okay, this one, they didn't add their name. Good morning. I'm watching from the north. Kindly ask doctor how often one should go for dental care within the year.
Okay.
Good morning. I'm watching from Choco. My name is Ache. Please, I want to know if it's advisable to use mouthwashes.
Okay. All right. So the number of times to visit is every 6 months. So that's twice a year. Okay. And then the second question about mouthwashes. Yes, mouthwashes are advisable. We have different mouthwashes on the market. So Listerine is one of the brands that is recommended. It gives you a fresher breath. But there are medicated ones as well, like the chlorhexidines and then chlorhexidine gluconate and the others. Those ones are prescribed. And the reason why they are prescribed is because if they are used for prolonged periods, they may end up causing teeth staining. So if it's been prescribed for you, that's the chlorhexidine gluconate, if it's been prescribed for you for specific periods, let's say for 2 weeks, please don't go beyond the 2 weeks if it's done. Don't go and purchase again and then continuously use it again, because it will end up giving you some side effects like causing the stains on your teeth and all of that, and discoloring your teeth as well. Yes, so yes, mouthwashes are good, and
Doc,
it has to be used appropriately.
Very briefly, what's the science behind the whole use of salt water to rinse gums?
Okay. So salt water, usually we say warm salt mouth rinses. Okay. So salt water, it has to be warm. That's one, warm. Two, it has to have some salt, and then so the warmth within it has to do with healing. So when blood contains what? White blood cells. And white blood cells is what helps with healing. Anytime you have maybe an infection somewhere, or you want healing, you have a sore somewhere, you want healing to take place. Now, for you to get these white blood cells to the system, to the area, you need to get your warmth. And the warmth, what it does is that it dilates the blood vessels. So once, let's say your tubes are smaller, means the volume of blood that is reaching the area. But then if the warmth dilates it, more blood gets there, and if blood gets that, more of the white, and then you have your healing that you want. Now the salt, what the salt does is that it acts as an antiseptic or antimicrobial agent. So the salt would, most of the bacteria have some cells. So then it causes osmosis, such that the cells within these bacteria or whatever is taken away. So it kills them. It either kills them or it slows down their replication. So that's the science behind the warm salt mouth rinses. So if it's recommended, is because of warmth getting blood to the sites, and then in extension white blood cells to the sites, and then the salt being an antimicrobial agent that will kill whatever bacteria or whatever microbial agent that is at the site. Okay, so that's basically it. So let me just touch on the brushing techniques quickly. So as we've mentioned, you need a medium for an adult, and you need the small the soft
for
the children. And the brushing techniques, we don't want up-down brushing. Okay, so the up-down brushing, what happens is that you tend to push away your gums. Okay, so imagine you are doing up-down for the next 20 years. You can imagine the destruction you would have done. Yes, you would have pushed your gums away and then exposed the surfaces of the root of your teeth that are not supposed to be exposed. Okay. And that will lead to gingival recession. And this gingival recession would end up with some hypersensitivity. So now you end up having this short, sharp pain associated with temperatures and even taking in of certain kinds of foods. The other is that doing the horizontal brushing. I know that a lot of people do horizontal brushing. When they wake up, oh yeah, we are going that way. Okay, so that horizontal brushing is also not recommended. The reason being that if you have this horizontal brushing done for a very long period, it also causes gutters to form around your teeth. So these gutters that form would end up giving you hypersensitivity in the long run as well. And then you may end up with pain eventually. So the recommended is to do it in circles. So you put the toothpaste on your toothbrush and then you go all the way to one corner of your mouth, either the right or the left, and then you start brushing in circles. So you brush in circles till you get to the midline, and then you change direction and go all the way to the other side. Okay, so that's for the outside. Then you open your mouth very wide, and then you put the brush at an angle of about 45, and then you sweep out, okay, for the insides. So you sweep it out, and then eventually to clean the lingual and surfaces of your teeth. Then where you put your food to brush, to crush your food, that side you can do your horizontal brushing on that side, and then you bring out your tongue forward, and then you brush that also in one direction from the back outwards. So this is ideally how you should do your brushing. And then also flossing. Flossing is very important, where you clean in between your teeth with the flosser. So if you can't at all do flossing, at least try and do it once every day, which is the best time of your day where you have a lot of time. So possibly in the evenings where you have a lot of time, you're not rushing to get to work early. It's important because if you do not floss your teeth, that means that you wouldn't have taken care of the plaque that has accumulated over that 24 hours in between the teeth. And those are small areas. And that can actually start the gum bleeding that we are talking about today. And to also mention that aside you doing your flossing and then you brushing effectively, the other thing that you would want to do is to visit the dentist at least 6 months. Okay, every 6 months you have to go and then have professional cleaning done for you as much as possible. And I'm sure this would help reduce the rate at which people end up getting to the hospital with gum bleeding and all of that. And if we are able to take care of this 90% that is caused by gingivitis or periodontitis, and we still investigate and we notice that it isn't coming from the mouth, then we can look at other areas that I mentioned, like systemic or some nutrient deficiencies or other cancers that may end up predisposing you to getting gum bleeding.
There's so many questions here for you, but quickly, just to yes or no.
Okay.
Is hydrogen peroxide safe? Can baking soda be used to
brush your teeth?
Rinse,
okay. Yeah, so hydrogen peroxide, yes, it is safe, but it has to be done in particular proportions. So if you take maybe one portion of the hydrogen peroxide, you need to dilute it with another portion or equal proportion of water before you use it, and it has to be prescribed for you. And then the second one was baking soda. Baking soda is an abrasive agent, so it helps to remove stains around your teeth, but it also needs to be done with particular percentages. So you don't need to, otherwise you may end up causing bends to almost every part of your mouth, and then that can end up also giving you trauma and then gum bleeding. So it has to be done in moderation.
All right, Dr. Carlson, thank you so much. There's so many, my tab is still vibrating, but unfortunately we have to end it here. We're sorry, but we will definitely continue this conversation some other time.